So welcome everyone to the XPrag wine gatherings. I'm very happy to see you, especially in these scary times. So of course our thoughts are with the Ukrainians, and we thought if there is anything you can think of how we can help, you might share it in the chat later. The important thing I think right now is that we stay united, and it's a good coincidence that tonight we have one of the biggest role models when it comes to creating communities. So this is also the purpose of our series, and we're very happy to have the Italian queen of experimental pragmatics tonight, Valentina Bambini, and I'll hand it over to Ira to introduce Valentina.
Thank you. Well, I mean, it's a pleasure to have the opportunity to introduce Valentina, who I remember when she was just this big, you know, early on in her career. I remember her walking around Lyon at the conference that we were having there, and really excited, and you know, having had I think a poster or a talk, I forget, but who knew that you know, 12, 13 years later, you know, she and her group in Italy would create their own XPrag.it. For those of you who don't know, she's an associate professor at the School of Advanced Studies in Pavia, and she studied at the Scuola Normale Superiore, where she got her degree in linguistics. And she, as I had the privilege to hear her talk about herself recently, she started out being very theoretical, and then she moved into experimental work, and now she's doing, I'd say, more clinical work. So she's got really the good roots for doing experimental work, and a lot of it's been on metaphor, which I'm assuming is what we're going to hear about tonight. So with that, I'll pass you Valentina.
Thank you, Ira, for this well, touching introduction. Let me share my my screen, see if it works. That's always a bit tricky.
I should add before you start that if people have questions during the talk, to put it in the chat, because that'll make life easier for us later when we call on people.
Okay. You can see my screen? Yes. Okay. I assume yes. Okay.
It looks kind of big, like as if it's not, and it's.
It might not be in the slideshow.
Yeah.
Yeah. Yeah. And that's how it looks.
Oh, yeah.
Okay. Yeah. You actually, I see. It's because you put a line in the middle.
Yeah, that's because I put, yeah, that's okay. A stylistic choice.
Okay.
Okay, we'll never do it again. Okay, thank you. Thank you, Ira and Nicole, for this invitation. It's a great pleasure for me to share my research finding with the XPrag community. And like Ira said, I've been working mainly in two fields, and one is the brain basis, the neurocognitive basis of figurative language understanding, and the other one is figurative language impairment, and more broadly, pragmatic impairment in clinical populations. And tonight, I will focus on this second line of investigation, with the aim of showing, on the one hand, how pragmatics can be useful for the study of language disorders. And on the other hand, how clinical studies can also help theorizing and solving theoretically relevant pragmatic issues. I will start by defining pragmatic impairment, which, following Louisa Cummings, can be described as the various ways in which an individual's use of language to achieve communicative purposes can be disrupted while structural language skills are more or less preserved. This is very important. Normally, pragmatic impairment is identified in those cases where individuals are not aphasic, but their communication doesn't work in a proper fashion. And these impairment normally are characterized by a failure in comprehending non-literal language, but also a failure in contributing relevant utterances to a conversational exchange. Traditionally, this kind of problems were attributed to individuals with lesions to the right hemisphere. And that's because historically, the first observation of problems in language that were not that could not be classified as aphasic were described in patients with lesions to the right hemisphere. That was at the end of the 50s, beginning of the 60s. Of course, at that point, Grice had not given his William James lectures yet. So the way in which neurologists described this kind of impairment was as difficulties with abstract language or higher than ordinary language. And this view that pragmatics is associated with right hemisphere and pragmatic impairment is associated with right hemisphere lesions became very popular over the 70s, 80s, and 90s. And I remember when I was a PhD student, and I was reading the main book in neuroscience, which is the book by Kandel and colleagues, and that was the 4th edition, that there was a section titled "The Right Cerebral Hemisphere is Important for Prosody and Pragmatics." But if we look at the 5th edition that was published in 2012, the title of that section changed and pragmatics disappeared from it, and only prosody remained as associated with the right hemisphere. So what happened in those 10 years? Well, basically two main facts. And the first one is that pragmatics started to be massively investigated with neuroimaging techniques, which show that pragmatic task, pragmatic processing normally engages a bilateral network of activations in both hemispheres. These are just two examples of this quite extensive literature. This is a study that we did on metaphor comprehension that highlighted bilateral activation. This is a study on irony comprehension by Spotorno and Ira and colleagues, which also highlighted bilateral activations. And the second fact is that it became known that difficulties with the pragmatics of language are observed not only in individuals with lesions to the right hemisphere, but also in a wide range of other clinical conditions. What you see here is the table of content of a book that Louise Cummings published in 2017, and each chapter represented different clinical conditions where difficulties with pragmatics have been observed. And you see there's schizophrenia, traumatic brain injury, Alzheimer's dementia, non-Alzheimer's dementia, etc. There's even a more recent book that was published last year where she focused on pragmatic difficulties in underserved population. And so the chapter here deals with Williams syndrome, Down syndrome, Tourette syndrome, sensory loss. These are all conditions that, although not extensively described for it yet, have been shown to experience difficulties with pragmatics. So the last 10 years have really witnessed a change in perspective for what concern the brain basis of pragmatics and pragmatic disorders. And if we want to contribute to this change in perspective, to understand more about pragmatic impairment, what we need to start with is assessment. What we need to start with is having a test to assess pragmatic skills in clinical populations. And when I started, at least for the Italian language, the situation was not brilliant. There were very few tests, validated tests to assess pragmatic skills, and they had some flaws. For instance, most of them were meant for patients with lesions to the right hemisphere, so they could not be easily adapted and used in other clinical conditions. So what we did, we constructed a test and we validated it to assess pragmatic skills in clinical populations. And it's a test that is called APACS. APACS stands for Assessment of Pragmatic Abilities and Cognitive Substrates. And it's a test which assesses both the production of appropriate conversation, and this is based on a broad definition of pragmatics, which is very common in the clinical domain, but also the comprehension of implicit meanings, figurative language, and humor, based on a more focused and Greichen-inspired definition of pragmatics. In these slides, I summarized the study that we did on clinical populations by using the APACS. And so what is especially relevant here is the third column, where we reported the percentage of patients from our samples that were impaired in the global pragmatic scores that is derived from the APACS. And as you can see, it varies, but it's always quite relevant. And it's quite relevant also in clinical populations that normally were not considered in language studies, like amyotrophic lateral sclerosis or multiple sclerosis or adult with dyslexia, okay? So definitely pragmatics is something that is important to assess in the clinical settings. But today I will focus on schizophrenia that, as you can see from the table, is the condition where we observe the highest percentage of impairment, 77%. Let me say a couple of words on schizophrenia. Schizophrenia is a devastating mental disorder that affects between 0.5 and 0.7 of the world's population. And it is characterized by a cohort of symptoms that include delusions, hallucination, apathy, emotional flattening, but especially it is characterized by cognitive impairment. So individuals with schizophrenia have impairment in working memory, executive function, attention, etc. And more recently, it became known that also social cognition is impaired in this population. And remarkably, these seems to be core features of the disease. They are quite resistant to pharmacological treatment. They are stable from onset. How about language? Language is not in this classic table of description of the feature of schizophrenia, but actually it is well known that there are some language disturbances in schizophrenia, and they've been known since the first descriptions of the illness by Emil Kraepelin or Eugen Bleuler more than 100 years ago, and they are also included in the last DSM-5 published in 2013. What is the classic way in which psychopathology described language disturbances in schizophrenia? Generally, these disturbances are described in terms of tangentiality and derailment of speech, and in terms of concretism. By tangentiality, clinicians mean a discourse that goes off topic, it derails. And by concretism, they need a difficulty with abstract concept. And here there's an example taken from the clinical literature that illustrates both features. So a patient would ask to explain what it means that gold goes in at any gate except heavens. And the patient answered, there's jewelry, there's platinum, they use it on your teeth for filling, there's gold in churches, there's gold in the mosque areas like Lincoln's tomb. And so you can see both aspects here. But of course, this is the description of psychopathology. We can also try to describe these disturbances in a linguistic way, from the point of view of linguistics. And I always cite this review by Covington and colleagues, which tries to do precisely this, to offer the linguist view on language in schizophrenia. And if you do so, what happens is that pragmatics, this is taken from their paper, pragmatics is the level of language that is most obviously disordered in schizophrenia. So I would like to illustrate this a bit more closely by giving you some details on the study that I mentioned in the global table earlier, where we observed that 77% of patients with schizophrenia perform below the normative base cutoff established on the general population. in this study, we tested a sample of 47 individuals with schizophrenia and 35 controls with the APAX test. And here you can see the performance of the two groups in each task that is included in the APAX. So patients perform worse than controls in all the tasks that were included in the APAX, but those tasks where the effect size were biggest are the interview task, which is a semi-structured interview where we assess the coherence of speech, the narrative task, where we assess the understanding of implicit meanings in a narrative text, and figurative language understanding. And if you think about it, this is nothing but tangentiality and concretism as described in the classic psychopathological literature. But something that we did in this study was also to look at the relationship between pragmatic impairment and impairment in cognition and in social cognition. Like I said earlier, schizophrenia is characterized by cognitive impairment and sociocognitive impairment. Therefore, it represents a good test ground to investigate the issue of the relationship between pragmatics and other skills, which I don't go into the details now, but it's a largely debated issue. I mean, there are authors claiming that theory of mind has a major role in pragmatics, author claiming that executive function has a major role in pragmatics. So we can try to see how schizophrenia can answer these kind of questions. And indeed, the sample of patients that I mentioned was assessed not only with the APAX test, but also with the box test for cognition and with a theory of mind task. And then we did a regression analysis with pragmatic scores as the outcome and theory of mind, cognition, and other demographic and clinical variables as predictors. And what it turned out is that there is a multiple interplay of factors that influence pragmatic skills. So there is theory of mind, there is the general cognitive profile, there's also IQ, but none of them can really fully explain the global picture. So what we concluded in that study is that pragmatic impairment is a core feature of schizophrenia because it affects a large percentage of patients, even stable patients like the one that we tested. It affects different domains of pragmatics. It shows diffuse correlation with other cognitive domains, but no overlap. What we did in another study was to focus a bit more on concretism. We wanted to use insights from pragmatic theorizing to explore concretism a bit more into the details. And we know, based on theory, that figurative expressions are not the same. There are differences between them. And in particular, we focus on the difference between metaphors, expression like my lawyer is a shark, that can be defined as loose uses of language with varying degrees of familiarity. They can be more or less novel, that involve a conceptual shift. Idioms that are highly conventional strings of words, whose meaning is partly stored in semantic memory. And proverbs, which are a little bit like metaphor, because they are metaphor-based, a little bit like idioms, because they are fixed and conventionalized, but they also have some special characteristics. So they normally convey well-known truths, social norms, moral concepts. And these phenomena are accounted differently in relevance theory. Metaphor and idioms are accounted for in terms of lexical adjustment, context-based lexical adjustment. So according to relevance theory, there are processes like conceptual broadening that are used to understand idioms, metaphor in a continuity view from literal to more radical figurative uses. While proverbs are accounted for in different terms. There's not a lot of theoretical literature on it, but in the Sperber-Wilson 1995 books, we can find some insight on proverbs, which are accounted for in a echoic term, a little bit like irony, because when we utter a proverb, we echo something that could have been said based on social norms and moral concerns. And so we focus on this distinction, and we wanted to see how this impacts impairment that patients have with figurative language. So we did a fine-grained assessment by crossing two factors, the type of figurative language, idiom, metaphors, and proverbs, and the type of task. So patients were presented with this expression either in a multiple choice format, so they had to choose the option between three options. They had to choose the correct one that expresses the meaning of the figurative language item, or as a multiple, as a verbal explanation task. So they had to articulate the meaning of these figurative expressions. And what we observed is what you see in the picture here. Patients, light gray, perform worse than control, again, in all tasks, but there was a major drop in the verbal explanation of proverbs. So when they had to articulate the meaning of proverbs, their performance radically dropped. And this matches with the echoic account. Probably this extra level of representation is what trigger the greatest difficulty that we observe here. So basically, driven by theoretical insight, we could show that concretism is a nuanced phenomenon, and it's influenced by the type of figurative expression. In another study that we are finalizing now, where Luca Bischetti is the first author, we are further zooming into concretism. And we investigated how different types of the same figurative expression, in this case, different types of metaphor, can affect concretism in schizophrenia. And we focus on distinction between physical and mental metaphors. By physical metaphor, the literature refers to those expressions that require inferences about physical or behavioral aspects of the metaphor's topic, something like some cooks are barrels. By mental metaphors, we refer to expressions that require inferences about mental aspects of the metaphor's topic, like some politicians are peacock, meaning that they are vain, so mental, psychological characteristics. And this distinction proved to be relevant in a number of domains. There are developmental differences between physical and mental metaphors that were shown already in the 70s. There are differences in the involvement of theory of mind. Mental metaphor triggered the involvement of theory of mind much more than physical metaphors. And there are also differences in the brain response to physical and mental metaphor. How does this impact concretism in patients? So we use the physical and mental metaphor task that we have created and used in a number of studies already. That includes 14 items, 7 physical and 7 mental metaphors that are balanced for characteristics like familiarity and difficulty, but of course they differ in the preferred interpretation, physical versus mental. And we presented this expression in a verbal explanation task. So participants had to articulate the meaning of this expression. And we scored them for accuracy, meaning whether the answer were touching upon salient characteristics of this metaphor, and for interpretation, whether the interpretation was physical or mental. Now, patients perform worse than control inaccuracy for both types of metaphor, which matches with the idea that there is an impairment in metaphor understanding. Mental metaphor were a bit more difficult. You see them in orange in this graph, but this was both in patients and in control. So there was nothing special about mental metaphor in patients. But when we look at the interpretations that patients give, now we see something special about mental metaphors. When patients were presented with physical metaphors, like some cooks are barrels, even when they gave wrong answers, these answers tended to remain physical. For instance, they drink wine. But when they were presented with mental metaphors, like some politicians are peacock, their answers were not mental. They tended to be concrete, physical. They have a huge, beautiful tail. They are hairy and things like that. And so you can see this in a graph. So for physical metaphor, there was the same probability of offering a physical interpretation in patients and controls, while for mental metaphors, there was a much lower probability of providing a mental answer in the schizophrenia group compared to the control group. So concretism is a nuanced phenomenon, not only because it depends on the type of figurative expression, but also within the same figurative expression, there might be differences. But how relevant is all this from the clinical point of view? I mean, it's interesting to see that the echoic account of proverbs finds confirmation in patients' behavior, but how relevant is it for patients' quality of life? And this is a study that we published last year where we try to answer this question, and we look at the impact of pragmatics on quality of life and everyday functioning. There's a great deal of research on finding the best predictor of functioning in schizophrenia, and nowadays the shared model is this one, where cognition is identified as a main predictor of daily functioning with the mediation effect of theory of mind. Where in this study, we show that if we add pragmatics to this model, the variance explained increases. And so pragmatics is a relevant factor affecting functioning and quality of life in the individual. And therefore, it is a relevant target for intervention and rehabilitation. And here comes the last study that I would like to mention today, which is a study that we published 1 month ago, was out on February the 2nd. And it's a study where we try to restore and train and promote pragmatic skills in schizophrenia. And I'm particularly proud of this because for me, creating a training program was quite a challenge. I mean, I'm used to create tasks to assess skills and comprehend pragmatic skills, but training them is something else. And how did I do that? Well, we went back to theory, and we went back to Grice. And we created a Gricean-inspired intervention program, which is called Pragmacom, which uses a series of narrative prompts where there are some communicative mismatches. So someone is violating the Gricean rules of conversation. And then we try to increase awareness of these violations, and we try to trigger reasoning about pragmatic rules of conversation via awareness of the consequences of their violation. And I will give you an example of how these exercises, these narrative prompts are structured. So for instance, we present a story where there is a communicative mismatch, like a participant uttering the lawyer is a shark, and another one answering why he has no fin. So the other participant has a literal understanding of the metaphor. And then we try to trigger the recognition of this communicative mismatch, and we try to teach the rule that could be applied to solve it. And finally, we try to improve generalization by presenting other contexts in which the same expression is used, and we try to stimulate the use of the metaphor in other stories. So the Pragmacom, we used the Pragmacom in a study with 2 groups. One was assigned to the Pragmacom treatment. The other one was assigned to a active control treatment based on conversational activities. So patients were engaging conversation about newspaper article without an explicit focus on pragmatics. There were no differences between the 2 groups in any skill, not pragmatic skills, but also not cognitive skills or clinical aspects. Both groups were engaged in 13 sessions of 40 minutes each once a week. And the 2 groups were tested pre-training, post-training, and a 3-month follow-up for pragmatic skills with the APACs and with the physical and mental metaphor task. For abstraction, which is taken from symptom scales used in schizophrenia, and for quality of life. And these are the effects that we observe. So what you see here is the performance of the Pragmacom group in blue and the control group in pink. a post-training and a follow-up in the APAX test. And as you can see, the Pragmacon group performed better than the control group, both a post-training and a follow-up. So these benefits were durable in time. We also got an improvement, both a post-training and follow-up, in the physical and mental metaphor tasks. So they were better in understanding metaphors. There was an improvement in abstraction at post-training, but this was not maintained at follow-up, probably because the control training was sufficient to promote these skills too. So there was nothing specifically about the Pragmacon for this. But what is especially important is that not a post-training, but a follow-up, we observe an improvement in quality of life in the Pragmacon group that was not there in the active control group, which means that after 3 months, patients could, in a way, consolidate their gains in pragmatic skills and their social relationship, their everyday functioning benefited from it. So this study is indicative of the malleability of pragmatic skills and of the fact that they can be improved in a durable fashion with an impact on quality of life, thanks to a theoretically grounded intervention program. So to conclude, I hope that this survey of different studies that we did on pragmatics in schizophrenia could illustrate that pragmatics is the key to gain a better description of the linguistic, communicative, but also cognitive profile of schizophrenia and other clinical conditions as well. Pragmatics is also key to shape intervention programs that can promote quality of life in this population. But if we look at the issue from the other perspective, schizophrenia is also a test ground for theoretical issues in pragmatics. For instance, for the issue about the role of theory of mind, that it's definitely present, but not exclusive in this population, or for different theoretical accounts of figurative language understanding, because we can see how this distinction impact the impairment in this population. To conclude, I have 3 slides. The first one is to acknowledge my collaborators. I will start from my closest collaborators, Luca Bischetti, a postdoc in my group, and Federico Frau, a PhD student in my group, but also Elisabetta Tonini, who now got her PhD, but she greatly contributed to the Pragmacon training, and also the new entries, Chiara Pompei and Biagio Scalingi, who just joined the group with a great project on metaphors of climate change and sustainable development that I hope I will be able to share soon with you. And finally, the people in other institutions, Giorgio Arcara from the San Camillo Hospital in Venice, with whom we created the APAX test, and Marta Bosia and her collaborators, Giulia Agostoni, who are the psychiatrists we work with. They do not only give availability of patients, but they really share the enthusiasm about this research program and their fundamental expertise. I mean, this kind of work cannot be done but in collaboration with clinicians. Second slide I have is to invite joint efforts and further collaborations. We created the APAX test in Italian, but of course, cross-linguistic assessment of pragmatic skills is key. This should be done in other languages, in other populations as well. So over the years, APAX grew, and we now have a Flemish version, an Hebrew version that was published a couple of months ago by Nira Mashal, a Russian version in the pipeline, a French version with Nicolas Petit is taking care of this, and also German version is in the pipeline, thanks to Nicole and Judith Besenbeck. So I definitely invite you to get in contact if you want to develop other versions, you want to use this version, and this is true also for the other tools I mentioned, the PMM, the training. We are definitely open to cross-linguistic studies. Third and final and most important slides come to XPrag 2022 in Pavia next September. This is a conference that we have already announced. It's the 9th XPrag International Conference that I'm organizing together with Filippo Domaneschi. We have a stellar list of invited speakers: Nicole Gotzner, Stephen Levinson, Anna Papafrago, and Mark Pell. The call for paper was supposed to be out last Monday, but we had some technical issues, and it will be out tomorrow or on Monday with a deadline in early April. So definitely stay tuned, submit your best works. We have a lot of submission options, pre-register poster, an XPrag ET awards for the best young presentation. So come to this event for a post-pandemic nice XPrag meeting and reunion. Thank you for your attention.
Thank you so much, Valentina.
Thank you.
Thank you and Grice for helping patients improve life. So there are some questions in the chat.
Well, there's a question from Napoleon.
Yeah. Hi, Napoleon.
Hi, Valentina. Thank you so much for the presentation. I'm really glad I didn't miss this one. I might have missed it, but it's great I didn't. And there's lots of things I'd like to comment and some questions, but I'll just ask a general one. I see people asking about the proverbs and the idioms. I won't ask anything about that. A general one about where you feel the direction of research is going in pragmatics and schizophrenia. In terms of the field that I know, which is pragmatics in autism, you know, there's been 30, 40 years of a perspective on it, which was, you know, what's wrong? What's wrong? What's non-typical? You know, in terms of the phenomena, the pragmatic phenomena that autistic people could or couldn't succeed with, you know, implicatures, metaphor, irony, indirect speech, and then what's wrong in terms of the mechanistic reason why they're not doing it right. And more recently, people have started saying, okay, right, okay, sure, it's interesting to know in which ways, you know, autistic pragmatics isn't the same as neurotypical. But what is the autistic pragmatic system? You know, shall we, you know, beyond just saying, well, they're not doing what the neurotypicals are doing in this and that, let's see, what are they doing? You know, what is the pragmatic system in autism? And there's a few, very few studies going out now, which are no longer, so to speak, comparing the autistic pragmatic performance with the neurotypical, but they're just asking like the question of how to describe the autistic pragmatic, you know, what's the cooperative principle and maxims for autism? And there are cooperative principle and maxims for autism, but they just seem to be somewhat different. Do you feel the same? Is there a similar question going on in schizophrenia? Because a lot of the work, a lot of the vocabulary that's being used is, you know, deficiency here, deficit there, impairment here, impediment there. Is there a sense that beyond understanding how they fail to do the neurotypical metaphors or idioms or proverbs, let's understand what it is that they're doing?
Yeah, that's a very interesting point that you are raising. No, there's not a similar discussion in the field of pragmatics and schizophrenia for two reasons. First of all, there's quite some literature on pragmatic problems in schizophrenia that does not use the term pragmatics. So it's not uncommon to find a study on discourse incoherence, perhaps assessed with automatic tools in schizophrenia without even one occurrence of the term pragmatics in the paper, or something on impairment in figurative language understanding and no use of the term pragmatics in the paper. So very often discourse is just considered upon the umbrella, under the umbrella of language, and figurative language or humor and irony are considered under the umbrella of social cognition. So there we are a step back in the field of pragmatics and schizophrenia, because there's still the need of let's say, claiming clearly and explaining clinicians that these things are pragmatics, okay? But apart from that, there's a deeper reason, which is the fact that it's not a developmental condition. So in a developmental case, you really can ask what kind of alternative system was developed in those cases, in atypical populations. While in adult clinical population, people normally assume that it's the neurotypical system that gets damaged, okay? And that's why you can start from a classic model of pragmatics and assume that there's something damaging it. You can assume that the maxim works as they work in the typical population, and this system gets damaged. So I think that there are these two reasons why the field is different and does not have this kind of discussion. There's a lot of focus on, let's say, what you can do automatically, basically. That's definitely where the field is going now in language and schizophrenia, and also pragmatics and schizophrenia. So for instance, now we are trying to develop some semi-automated account of language and pragmatics in schizophrenia with Luca and Federico. We are trying to do so, but it's of course quite hard, but we'll see.
Okay, we'll move on to a question from Sunny Dang.
Hi.
Hi.
My question is direct. Were there practice effects, or was that practice effects an issue in the clinical trial when you were looking at the post assessments and the follow-up?
Yeah, well, thanks for this important methodological point. That's the reason why we had the control group to rule out practice effect. And so basically, that's the main reason why we have a randomized control trial design with an active control group. I would say that the improvement that we observe in the Pragmacom group is not due to practice effect because it was not there in the active control group. Besides, also the tests that we used, the APAX and the PMM, have been validated for practice effect, and they seem to be not sensitive to practice effect. So there are methodological ways to control for it, and we did so.
Okay, next question from Petra.
Hi, Valentina. Thanks for the rich and comprehensive presentation. A lot of food for thought. I would like to ask something about the proverb metaphor idiom study.
Yeah.
So how do you explain the task effect? So in the multiple choice task, they did very well on the proverb. So that means they can comprehend it and have some kind of representation of them. But then in the description or narrative task, they didn't perform that well. So is it production, or how do you explain that difference in terms of the task?
There are a series of differences between the multiple choice task and the verbal explanation task. Verbal explanation task is more difficult because it taxes more on language in general, because you have to articulate, like you said, it's production. But it's also more taxing, according to the literature, in social cognition involvement, because you have to, in a way, tell the answer to someone else. And so there's a higher involvement of sociocognitive processes. There's a meta-analysis that we did, and this one was on actually the autistic population, where we compare metaphor tasks in the multiple choice format and in the verbal explanation task. And definitely the biggest differences between the two groups are observed, between the autistic group and the neurotypical groups are observed when you use the verbal explanation task. So this seems to be consistent across different conditions. Probably it has to deal more with the taxing on language and on other skills, perhaps also executive function, because you have to articulate a quite complex response. However, there are advantages in using the verbal explanation task. And the main one is that it's the only way you have to be really sure of what they were interpreting. While with the other implicit task, you are less sure of this. So definitely there are different reasons why verbal explanation is more taxing. But this was in interaction with the figurative type. So verbal explanation becomes especially difficult with proverbs specifically. And that's something triggered by proverbs, I guess. Thank you, Peter.
We'll stay on the topic of proverbs. Larry has a question.
Yes, it's actually quite related. I was wondering whether one difference between the metaphor and idiom tasks and the examples, especially with the explanation task versus proverbs. And I believe that irony would be similar to proverbs in this respect, although it wasn't part of the study. In the case of metaphor and idiom, there's a more straightforward problem in interpretation. So my lawyer is a shark. As Grice pointed out, the initial reception of that is that it's a false statement, and the reasoning is it's so obviously false that couldn't have been what was intended, because there's a mismatch between the kinds of things that are sharks and the kinds of things that can be lawyers. And similarly, in Break the Ice, there's a referential failure. Grice didn't talk about that example, but clearly if you talk about breaking the ice in a context in which there's no ice, or kicking the bucket in a context in which there's no bucket, there's a direct link to there being something wrong, and another kind of interpretation is needed. Whereas with the proverb, there is a literal interpretation, which is perfectly coherent. It's just that at the discourse, at the higher level, it's not clear how, for instance, a leopard cannot change its spots is relevant to a discussion, say, of say the Taliban refusing to modify their actions, or the early bird catches the worm, or a journey of 1,000 miles begins with a single step. I mean, all of those are true statements. And similarly, ironic statements have a level of interpretation in which they're simply making a particular claim, and it takes a little bit of work through theory of mind, to figure out that something else must have been intended. And I would imagine that in the verbal explanation, that would also require a lot more work than to describe what goes wrong with breaking the ice and my lawyer is a shark on the literal level. So if that's right, then I would expect irony to pattern with proverbs as opposed to metaphors and idioms in the kind of problems that they would cause for both schizophrenic patients and possibly, from what I've read, autistic ones as well.
Is there a question?
Well, is that right? Is that your sense too of what would happen?
Yes, definitely. Definitely, I would expect the same. There's some literature on irony in schizophrenia. The literature reported impairment. There's not a comparison between, let's say, metaphor, figurative language like metaphor, idioms, and proverbs and irony. Especially, there's no comparison between proverbs and irony. But I think it would be very interesting to test whether they sort of pattern together, thanks to the echoic element or these other elements that you mentioned.
Right. I'm not sure those are inconsistent explanations. They might kind of converge on the same sort of distinction, both the echoic or non-echoic dimension and the sense in which what you're saying is perfectly coherent at a lower level, and it's only the higher level of motivation and theory of mind that you get this kind of clash. And
perhaps we could try to answer this question by adding a further condition, which is humor. We share some aspects with irony, but it's not echoic.
Right.
And perhaps this could help discriminating between the echoic account and what you mentioned. And we are starting testing humor in schizophrenia, so perhaps we will do this.
Great, thank you.
Thank you.
We have a question from Mira and then Nausicaa.
Hi, thanks a lot. And I raise my hat to you for crossing over to clinical, really. I was impressed. Okay, so my question, I think, goes in the same direction maybe as Larry's and others. So we talk about pragmatics, but there's so many things that go under pragmatics. So the specific question I have is there a difference between so-called free inferencing, like in particularized conversational implicatures, where you say something and I somehow need to do something about it, and things that are really the speaker indicated that there's some work to be done. Okay, there's some implicit meanings to be accessed, like factive verbs. I don't know. Do they take into account presuppositions, reference, discourse markers, all these things that have, you know, sort of built-in non-literal meanings like discourse markers. So do they behave in the same pattern, or are they each, you know, everybody is different?
Thank you for this question. There's literature on almost all the phenomena you mentioned. There's literature on discourse markers in schizophrenia. There's a study by an Hungarian group which showed that individuals with schizophrenia use less discourse markers compared to the control group. There are studies on inference in schizophrenia done outside the domain of pragmatics. So there are problems with inferencing in schizophrenia or in general. For instance, there's a well-known effect, which is a bias against this confirmatory evidence. So once they jump to a conclusion, they have difficulties updating this conclusion by making new inferences based on novel evidence that becomes available. To answer your question, I would say that these specific pragmatic domains that we as linguists know and would list in a handbook of pragmatics, sort of, are generally impaired in schizophrenia. And I think that there is an underlying reason, which is an impairment in inferential processing, basically. I don't know if I answer your question, but from a, let's say, the point of view of the linguistic behavior that we can observe, pragmatics is really obviously compromised in schizophrenia. Even the ixis is compromised in schizophrenia. So they perform worse than the control group, despite the fact that structural language is usually preserved. I should be clearer on that. If you do a fine-grained test of syntactic comprehension in schizophrenia, and we did one with Andrea Moro a few years ago, you will find that individuals with schizophrenia perform worse than control. But of course, this is a clinical condition. Also, their working memory is lower, their attention is lower, their skills are generally lower. But if you take an aphasia test, where there is like, you have to, you know, pair the sentence, the girl is kissing the boy, something very, very simple, very big. Well, this is not so simple. Like the girl is kicking the ball, something like that, and they have to pair the sentence and the picture, they would not perform as bad as individuals with aphasia, okay? So the structural language is, let's say, more or less preserved in this population, but the pragmatic domain is really very vulnerable, and I'm using an adjective that Ira doesn't particularly like, but I hope that what I mean is clear, and the pragmatic skills are really vulnerable in this condition. I hope I answer your question.
Yeah, but can I have a short follow-up?
Go for it.
Okay, so there are some lexical items, let's say, that really have a conventional meaning, even if it's so-called pragmatic in that it doesn't affect truth conditions, like but, okay? Like given us, you know, absolutely, old information markers. How do they do on those? Okay, so do these belong to the structural part, or do they belong to the pragmatic? How do they pattern?
That I would not know, but also, I mean, conventional aspects, when they have to deal with context a little bit, are damaged. And I can mention a study that focused specifically on idioms, ambiguous and not ambiguous. And the ambiguous one are those that can have a literal, plausible literal interpretation, while the non-ambiguous one do not have a plausible literal interpretation. And so both are conventional, but the ambiguous one rely on context much more. Well, anyway, both types were impaired in schizophrenia. This is a study, first author is Schettino. So I would guess that also conventional inferences that are attached to expression like but can be compromised in schizophrenia, but this I do not know. Of course, it should be tested. And to answer your question, whether it patterns more with structural language or with pragmatics, how frequent this impairment is, if it's as frequent as structural language impairment or as frequent as pragmatic impairment, that really will need to be investigated. And notice that, I mean, it's not common to assess pragmatics in a clinical setting. So although there's literature, not as much as there is for autism, for instance.
Okay, let's
Thank you
move
very
on
much.
to what will be our last question from Nausicaa.
Hi.
Thanks. Hi,
Nausicaa.
Valentina. Thanks a lot. It was a beautiful talk and amazing data. So I have a much more open question about the intervention study. And I was actually quite impressed with this idea that you still found an effect 3 months later, and in particular, this effect on quality of life. So I really have two kind of small questions. One is just how exactly do you look at quality of life? I mean, that questionnaire that you have.
Yeah.
And the other one is just generally how do you can you imagine in the future that I suppose this effect would end up by tailoring off? So what could you suggest something that could be done? Maybe a more long-term intervention or something like that.
Yeah.
Or did you think about it at all?
Yeah. I mean, the test that we use, it's called quality of life scale. And it's a bit of a hybrid test because it assesses both quality of life and daily functioning from a subjective point of view. But there is some check from the clinician. And it's I would say, the most widely used test for functioning and quality of life used in schizophrenia. And basically what it assesses is interpersonal relationship. So there's a lot on social relationship, but also personal autonomy. So the ability to go grocery shopping on your own. And also the ability to have other function like to work, to have a job, to take the bus. So this is what the scale is assessing. So really functioning, but also there are questions on the subjective experience and subjective evaluation of the quality of life. And in the study of Agostoni 2012 that I mentioned, where we found that pragmatics is a relevant predictor of quality of life, actually we found, and this is not surprising, that the subscale of the quality of life scale on which the effect of pragmatic is especially relevant is the interpersonal relationship one. So it's important for communication and for these aspects. But in the training study, we used the global score to assess whether the training had an effect. And this was visible at 3 months follow-up. And as you notice, I mean, it's not, it's important, but it's not enough. We should see whether this is maintained at 6 months follow-up, for instance, a 1 year follow-up. And this has been done in the field of cognitive remediation, where there's a lot of interest and investment. There's a lot of research on cognitive remediation, and I wish there could be similar investment on pragmatic remediation. Something that we could do to promote this durability further, if I understood your question, is to have some boost sessions. So after a certain number of weeks, you do some booster session to patients with some pragmatic center exercises. And this proved to be effective in other domains, and it might be in the field of pragmatics too, but we haven't done this yet.
Wow, that was a great session, Valentina and questioners. I'll pass the parole to Nicole.
Yeah, I couldn't agree more. So let's thank our speaker again for this wonderful session today.
Thank you.
And we'll see you in April, so mid next month. Our speaker is Daniela Matthews, who will talk about pragmatic development. And in the meantime, everyone, please stay healthy and safe. And we look forward to seeing you again very soon. Bye-bye.
Bye-bye. Thank you for being here tonight. Bye-bye.
Bye.
Can I stop the recording?
I have to stop it.
Ciao, Ira. Ciao, Nicole.